welcome. Today we're going to talk about how to teach your baby how to drink from a straw. And the timing is variable, but it's probably most optimal between 8 and 9 months of age. But I have taught very young, probably 4 to 6 month olds, how to drink from a straw based on what was going on with their feeding or their breastfeeding or cup drinking or bottle feeding or whatever they were doing developmentally. But it's probably the easiest between probably 6 and 9 months of age. If you wait too long, it can be challenging because you're going to be at the time frame of when you're going to start eliminating the bottle. And depending on how easy it is to make that transition, that can make the bottle more challenging physically and emotionally to wean them off. So between 6 to 9 months, probably 8 to 9 is the easiest. The easiest thing to do is to take a straw and just dip it in something liquid with your finger on it, so you're pipetting it, and bring it to your child's mouth. And make sure when you start, there's just a teeny tiny bit, because if they start to make a movement towards obtaining the liquid, then you want to just release your finger, which allows the milk or water or whatever you're using to drip into their mouth. You don't want a large amount because you don't want to choke them. So again, you just like dip into that cup, bring it to their mouth. As they get more skilled, they'll start leaning towards that straw. They may try to bite it, so you want to make sure that you keep it fairly shallow. The optimal placement of a straw is between your teeth and your lips, and then you drink from there. So dip into the liquid, bring it to the baby's mouth. As they activate or try to obtain the liquid, you just let go, and that will be helpful. Now, you can thicken the liquid if you're concerned, if they're coughing or choking on it. And actually, let me back up. If they're coughing and choking on it, I'd like you to get a referral for a feeding therapist, because your baby should not be coughing and choking. If they are, I mean, it can happen once in a blue moon, but I don't think my kids coughed or choked on, well, my first one was a preemie, so minus him, my full-term babies did not cough or choke on anything. So it's not typical to cough and choke when you're eating. And if that's happening, I want you to get a referral. But otherwise, you just put it in the cup, bring it to the baby's mouth. Hopefully after a few trials, they'll start activating their lips and try to start sucking. And then you can hold that liquid for a little bit till you feel them sucking, and then you can let it go. And then you can get to the point where you just give them the straw and let them drink out of the cup. It should not be stressful. So if you're feeling a little stress about it, if your baby's feeling stressed about it, just stop for the time and try another time. And if you try several times and they really are not having it, don't worry about it. Just wait a little bit longer. Try maybe in a week or so. Or if you're concerned, call a feeding therapist and they can help you. And most feeding therapists are speech pathologists. There are some that are occupational therapists as well. So ask your pediatrician. You can certainly shoot me an email and I can help you track down a feeding specialist that can help you if you have any questions. Otherwise, the main reminders are: 1, just consider it somewhere between 6 and 9 months. 8 and 9 is probably the most preferable, but you can start earlier if you'd like. Just take your straw, pipette a little bit of liquid, make sure your baby is in an optimal position, just very gently let go. Make sure there's only a tiny bit, not an entire straw full of liquid to start with. And then as your baby gets more skilled, you can hold that the pipette tight for a little while till they activate more, and then release it, and then you put them to a cup. Hope this was helpful. Good luck. It needs to be fun and easy. If it's not, please consider getting some help. Thank you for your time. I hope you enjoyed this video, and if you did, please, please, please share it, like it, and please subscribe. There's a lot more coming. Thank you.